Hello, this is Andrew Merritt with ProLiance Orthopedic Associates. Today we have a video of a lateral meniscus repair. This is a tear that's typically associated with an ACL tear where the outside meniscus tears in the far back, and it happens by the shift that occurs when you do tear the ACL. This is a common injury in conjunction with the ACL. This video will give a step-by-step guide of how we repair the lateral meniscus in this type of injury. I hope you enjoy and thank you for watching.
The arthroscopy starts with an evaluation of the lateral meniscus tear. You can see here I'm using a probe to identify the unstable and torn fragments of the lateral meniscus. Normally, the meniscus should not have any of these fissures or tears that make them unstable. I use the probe to identify the extent of the tear, which extends to about this location. The rest of the meniscus towards the front or anterior from there is all healthy and intact, and the tear really just involves the back portion of the meniscus. This is important to identify the location of the tear as it will dictate how we do a repair. A repair of this type of meniscus tear is performed with making an incision in the back of the knee. From there, we're able to pass stitches through the meniscus and out the back of the knee. I use this cannula to aim the sutures that are attached to the end of a long needle. With this, I can pass sutures through the meniscus and into the back of the knee. You can see I've already placed a few more towards the back of the knee, and this is a classic example of how this technique is done. When the needles are pushed through the back of the knee, I subsequently pull, and the suture then reduces the meniscus tear. This is able to be then tied over the capsule on the outer portion of the knee and held very firmly. And you can see there where it pulls the tear nicely together. Once these sutures are placed, sometimes the meniscus starts to evert or gets pulled upwards. And so we do what is called a balanced repair by placing some sutures on the undersurface as well. This is done in the exact same technique. The sutures will be placed on the undersurface of the meniscus and allow it to be pulled into the appropriate location. It's very important to get the meniscus back in its normal position and under normal tension, and that is done by balancing the repair. Once the meniscus repair is completed, we then probe the meniscus to assess its stability. This is done after all of the sutures are placed and have been tied. What you can see here is that the meniscus tear is pulled nicely together, and when we go into the previous tear, you can see there is no instability in the meniscus. This is a typical lateral meniscus tear that we see commonly associated with an ACL reconstruction. This is Andrew Merritt with ProLiance Orthopedic Associates. Thank you for viewing.